What is mast cell and histamine intolerance? Because people think it's just about allergies, but Dr. Maggie, it is so much more. Today, we are uncovering the most uncommon, shall we call them, symptoms associated with it.
Uncommon yet common.
Mm-hmm.
So we actually asked in our Facebook group and all around social media, what were some of the actual symptoms that people had to mast cell and histamine intolerance? And to put it lightly, the answers were all over the map. And so today we're going to take a trip around the world and we're going to discover the most uncommon yet common symptoms of mast cell. Here we go, everybody.
Hi, everyone. Thank you so much for joining us for this, what I know will be an enlightening discussion about mast cell and histamine intolerance. Just you wait. I am Anna Manuel, your co-host for Transform Table Talk Live, alongside Dr. Maggie Yu. And I want to bring him in right away. We also have the one, the only, Dr. Jason Bradley joining us today. Hi, woman. Dr. Jason, thanks for being here as well.
You bet. I'm so glad to be here today. I think this topic deserves so much attention and so much discussion. So I am super psyched to just dive right in.
Yeah, I'm seeing a bunch of people already jumping in. If you're watching right now from YouTube, make sure you subscribe and ring the bell and get notified whenever we go live. And give us a holler, give us a shout in chat right now. Where are you watching from? What's your interest in this topic? Do you think you have mast cell? Do you think you have histamine intolerance? Have you struggled to even get a diagnosis or someone to pay attention to you? Or is there someone that you know that needs to hear about this discussion right now? Put their name in chat, whether you're on Facebook, whether you're on YouTube right now. Give us a holler. I would love to talk with you. And here's the deal. The more comments, the more questions you make, the longer we stick around and the more excited I get. So here we go. Feed me.
Yes, and I will be interacting. I'll be watching your comments. If you do have questions for either Dr. Maggie or Dr. Jason, the both of them, you've got the experts right here. So don't waste this opportunity. We'll get to your questions if we are able to, which we've got a lot to talk about. So, because I know so many people have already written on we'll call it a viral social media post about what kinds of symptoms are they seeing that they think are associated with these issues, mast cell.
Yeah. So first thing first is that a lot of people don't even know what we're talking about. What is mast cell? What is histamine intolerance? We've done several lives on this. And in fact, I have a 3-part training all around what is mast cell activation syndrome, histamine intolerance, and how to solve that problem. If you're interested in the 3-part series, type in chat 3-part, okay? 3-part series on that. But I have a training around that. We've done a lot of trainings. And the first thing is that it is very difficult to get a diagnosis of mast cell or histamine intolerance because the diagnostic criteria isn't very clear and the testing isn't very good.
It's crap. I want to jump in on there already. And not only is the testing, just not standard, but the training at the doctor level, at the provider level, there's not really a lot of training here either. Yeah. So it's not something that gets discussed beyond just some common symptoms. And like you said, it's related to so many things.
Yeah. And last week we had somebody who just commented that they said that they were told, this was somebody in Switzerland, and she said she was told by her doctor that her mast cell activation and histamine intolerance syndrome was a diagnosis that's not real, and it's somebody's imagination, and it's all 100% based on anxiety and past trauma.
Then we're getting back to the medical gaslighting once again, which I know was another viral post, because to be told that something that you are truly experiencing and have symptoms that you can even show isn't real. That's
and Missy right here, and you guys jump in with what your most common symptoms are, because I wanted to have a collective intent here is to just share with you how big and wide this net needs to be to understand you have a histamine issue. Okay. So everybody type in your symptom, 1, 2, or a bunch, go for it. Type it in chat right now. Give me one symptom that you have, and you're going to start seeing it pop up. Okay. In the chat and in the comments, there's just such a wide variety of symptoms. To begin with, when we're looking at mast cell or histamine intolerance, it is in a sense in the field of the allergist, because people identify this problem. Mast cells are allergy cells. Just a quick little picture. Okay. I'm going to show you guys. Mast cell is one of the white blood cells. Okay. Floats around your blood. And if there's pollen, environmental things you're allergic to, or if there's food that you're allergic to, these mast cells will have receptors on their body that says, we don't like that. And when that food particle hits that mast cell, the mast cell says, ooh, red alert, something we don't like, protect the body. What are we going to do? Secrete all these granulation of these, what we call histamines. All the little orange dots are histamines. Histamines, as you guys know, and you've heard about with antihistamines, is related. Most of us think about it as like the itchy eyes, the runny nose, maybe asthma, wheezing, or histamines can cause anaphylactic type reactions with the swelling of your mouth, your throat might feel weird, difficulty swallowing. Some people have problems breathing with it, and then the itching and the hives. Classic, what we call anaphylactic type allergy symptoms or seasonal allergic symptoms. That's not necessarily what is mast cell activation and histamine intolerance. But most people think that just having an extreme version of that is what mast cell and histamine intolerance is. And while that's true, that's a small wedge of the pie. What I actually see is that there's so much more histamine related reactions that we're going to go into because you guys are bringing these symptoms up. All right. And as we go into these symptoms, I'm going to explain the scientific reason why mast cell reactions and histamine reactions cause so many different symptoms that are baffling to your allergists, that are baffling to your primary care provider, because they don't realize it. They think, and they're misinformed, that it's just about really bad allergies. Okay. And then the testing and diagnosis suck. And then we have people with literally a myriad of symptoms all over the map. Marissa just says, let's see, Marissa says, it feels like my chest is tight, right? It's hard to take in deep breaths. This is some classic presentation, right? But then again, is that, allergic, and often people will put people with those type of allergic reactions into the panic attack group as a mental health disorder and it not being real. Heather's bringing up here diarrhea. Would you guys think that diarrhea is actually an allergic related symptom? Could environmental allergens, could food allergies cause diarrhea? And I know Dr. Jason's already shaking his head like a bobblehead. What do you think, Jason?
No, absolutely. Right. And I think that that's what's really misunderstood, is that this is a whole system wide reaction. This isn't just, localized to the eyes, to the skin, to the throat. These are real system wide, body wide reactions. And again, not trying to jump back on this, but going back to the panic attacks, and I know that we've experienced this as providers with our colleagues. A lot of doctors, if they can't connect the dots, they literally will default to a psychiatric condition. So, if I'm not smart enough to figure it out, then it's not my problem, it's your problem. And here's the psych med of the day. And it's just an unfortunate, and then unfortunately people now are on psychiatric medications that they may or may not have needed. And they're not getting the underlying causes addressed.
We have tons of things coming in with people asking about autoimmune issues. I'm going to actually pull this up right now. So one of the things is I wanted you guys to actually look at this diagram. Okay. I made this, created this to demonstrate scientific fact. Okay. Scientific fact. And the fact that you're actually even here, take notes, by the way, take a screenshot if you want to, because what you're going to learn here, your allergist doesn't know about. Your primary care doesn't know about. Mayo Clinic doesn't know about. Okay. The best that they can do is if you qualify for their diagnosis, they say, yeah, you have the diagnosis, but there's not much I can do about this. And they'll even say a lot of these symptoms that we're going to talk about are unrelated to your mast cell and histamine. Go see somebody else or go take a psychiatric medication. Okay. Mm-hmm. So I'm going to dig in, and Dr. Jason has we've curated all the comments from the social media posts, and then the comments are going insane right now. So yeah, drop in if you're, as we go through some of these symptoms, if you're me too about it, say me too and tell us what your symptom is, because I want to validate that what you're experiencing is real, and it absolutely is related with mast cells, starting with inflammation. A lot of people start talking about inflammation. I want to define what it is first, because when people say inflammation, I think about it in terms of either swelling in a local area, but a lot of times I think pain, right? Pain. Someone just mentioned small fiber neuropathy, which is pain in the nerves, damage to nerves, right? What does pain from joints, muscles, or fibromyalgia or nerves have to do with mast cell? Could it be connected, or is it absolutely not connected? I want people in chat to chime in. If you already know you have mast cell, you have histamine intolerance, you have had some of these symptoms relating with pain and inflammation, type it in chat, because you're validating yourself and other people as I'm going to go into some of the scientific fact. Dr. J, were there some comments you want to share?
Yeah, that's what I was going to say. I was really impressed with the people connecting dots, or at least asking informed questions that they might be wondering about in the social media posts. As an example, we had on this particular one, we had Hope R literally just said, I think my joint pain is related to my mast cell, but no one will validate this. Can you please explain how my joint pain and mast cell go together?
I absolutely can, by the way. So did you know that scientifically, when a histamine, when the histamine molecule actually gets activated, it doesn't just go causing allergy symptoms, which we can also explain, but there's actually a histamine, what we call a pro-inflammatory pathway. So histamine will actually break down and drive down a pathway that actually produce inflammatory factors. So believe it or not, there are inflammatory factors in your body and throughout that when those substances are high, it causes pain. So we think about prostaglandins, there's arachidonic acid, there are all these intermediaries in your body that's chemically produced that actually causes pain, right? So what happens is that it is scientific fact that the histamine pathway will trigger the onset of increase in these substances, and you'll get more joint pain. You'll get muscle pain, and it's not just swelling. And some people, it will be actual swelling in a joint or an area. But nerves are very interesting. I want to talk about nerves for a second. So nerves are everywhere. So nerves are in the gut. They're throughout your body, right? And a lot of people think musculoskeletal pain, and that's pain. But nerves themselves can cause a lot of pain. How many have neuropathy? Type it in chat. Type it in chat.
There have been many comments about that neuropathy, and people talking about their pain here as well. Like Jill saying pain, Maria also saying chronic muscle pain.
So can I give you guys a secret mechanism with which mast cell contributes to pain? Okay, I'm going to link these things, and it's going to go fast, but write it down. Okay. So here's the thing. You guys have learned from other trainings that I've done. People with mast cell activation and histamine problems, these allergy problems, the underlying core issue that is a missing link is they have poor digestion. And I'm going to repeat this. Okay. Digestion is there to break down your food from bigger pieces to smaller, little, tiny pieces. When food is in really small, tiny pieces, they're highly absorbable, so nutrient rich. And number two, they're also less allergenic. So then if your digestion sucks, your food particles stay bigger, which means you absorb less. So you get a lot of vitamin and nutrient deficiencies. And number two, you develop a lot more food allergies. There is no one on the planet that I've worked with thousands of people with mast cell histamine issues, right? There's not one person I met with that had great digestion. One or multiple or all the steps of digestion are broken in one way or other. And yet your allergist will never say something like, oh, I know something about digestion. Your GI doc won't know jack about digestion. Your Mayo Clinic won't know jack about digestion, but that is actually the holy grail. Now, here's how the digestion and mast cells linked to neuropathy. Ready? Ready?
Edge of our seats.
You want it? They want it. Do you want it?
Oh yes, there have been a lot of yes, please.
You really, really want. Come on, Don. All right, I love this. All right. When you have poor digestion, one of the first steps that's broken in digestion is what we call acidification, which means stomach acid, right? And did you know that most people with mast cell, in fact, if not 90% or higher of them, have a problem with enough acid in their digestion process? First step. So when you have low or very little stomach acid, you can't absorb a critical vitamin called B12. B12 is the critical vitamin needed for nerves to heal. So now you can see how there's a connection between mast cell, poor digestion, and then as a result, severe vitamin and mineral deficiencies and nutrient deficiencies that will cause all these problems. So someone with mast cell, if they develop neuropathy, will not heal. Their nerves won't heal, and their pain perception will be 10 times worse because they don't have the critical factors, like not just B12, but what about magnesium? What about iron, right? What about omega-3s? Omega-3 deficiency. And I haven't gotten into that. Dr. J?
Yeah, I want to jump in here too, because I'm going to play the devil's advocate here and just kind of talk.
Come at me, bro.
Yeah. So, hey, Dr. Maggie, I thought, people had too much stomach acid. You know, that's why we prescribe all these PPIs and H2 inhibitors and all this other stuff, right? So like what's going on with that? Because you just said that people need acidification. Don't we have enough stomach acid?
So, okay, I'm going to ask the audience out there to play now. Everybody get ready to your keyboard. How many people went into their doctor with, I got heartburn, and got prescribed either Zantac, Prilosec, or a medication to shut off their stomach acid, and then developed their mast cell and histamine symptoms? Okay, don't let me tell you, you tell me. And this is what I see over and over again. And this is interesting. There is a huge rise in mast cell and histamine problems and food reactions because of the overprescription of Zantac, Prilosec, medications to shut off stomach acid. When the problem was never high stomach acid. The problem was, in fact, the opposite. These people had low stomach acid. And then we prescribe a medication that actually iatrogenically induces more food allergy reaction by killing off digestion.
And we're seeing lots and lots of people saying that is exactly what happened to me, my family member, my
mother-in-law,
my daughter.
Alicia, right?
Yep, severe. And so
yeah,
this is a problem when doctors are trying to give you these medications to solve the issue, but then it's making it worse and creating new problems.
Look at this. I mean, we're just seeing, like, literally, guys, there's like hundreds of comments flooding in all different social media with people saying, I was put on Zantac, I was put on Prilosec, and then I developed mast cell and histamine intolerance. So what I'm trying to tell you is there is actually a severe misunderstanding, mistraining, and I say full-on negligence in the fact that doctors aren't trained on digestion, every step of it. So currently in medical school, they're teaching people that if you have heartburn, it's because you have too much stomach acid, therefore prescribe this medication. And then we are actually creating an epidemic of people with mast cell activation and histamine intolerance as a result of shutting down their digestion. We're seeing this. It's all over here, right?
Yeah. And people are on this for years. You're only supposed to be on these medications if you need them for a short period of time, right? And yet Jill is saying, been on it for 25 plus years and I'm having body-wide problems.
Right. And that's just neuropathy. And how many of you have been told that your neuropathy has nothing to do with your mast cell or histamine intolerance? Your neuropathy has nothing to do with the food that you eat or your digestion. You guys know I'm a fan of the cursey word, so get ready for it. Okay? I think that's freaking bullshit.
That was a strategic cursey word. You know, I usually say that you have a mouth like a sailor. So, I mean, I appreciate the editing. The other thing that I just wanted to say really quickly, and just ironically, I was given a talk, I don't know, a couple of years ago about just some general, and I want to emphasize this, a general digestion, talk to the public from a functional medicine perspective. And after I gave the talk, I didn't know, but in the audience, there were 2 gastroenterologists that actually came up to talk to me, to invite me to their gastroenterology group, and said that every GI doctor needs to hear this. And I was like, This was basic digestion. This wasn't even like this wasn't like revolutionary. This was like, we need some stomach acid, we need some digestive enzymes, gallbladder's got to work. But yeah, you're spot on with how important digestion is with this.
Well, I'm actually even now with, you guys, I'm the only doc screaming about digestion, mast cell, food, working with getting your food sensitivities tested with the food mapping system. I'm the only person really talking about, like, these are the real solutions to solve this problem. And recently I've been invited to speak with restaurant groups and food service industry to really educate the food service industry around the topics around food allergens, digestive issues. It's interesting how, that's one of the biggest problems for people with mast cell and histamine intolerance is eating out. Mm-hmm. Eating food and then eating out. That's almost an extra exponential layer to this. How many of you guys know what I'm talking about? Yes. Right? And so one of the things people don't realize is people with the focus is just on, oh my God, an allergic reaction. But most of the time, believe it or not, when your customers come in and tell you that they had a reaction to your food, I would say about 60% of that time, 50 to 60% of the time, it's not even an allergic issue. They have a digestive issue problem with the food. So digestion problems are just as rampant as allergic related food reactions, and they make the allergic food reactions like 10 times worse.
Yeah, and I want to say with our social media, I kind of geeked out on the social media post, and I actually itemized everything.
You geeked out?
Never.
Comments to the least comments. And actually, I was impressed because, of course, hives and stuff, all this regular stuff was like the top response. But the second most common question that we had was about digestion. People asking, Jessica was asking, could this be related to my stomach pain, changes in my bowel movements, diarrhea, constipation, nausea, like all of those.
This brings up a really good point. Because when we're talking about it, under the mast cell, the histamines here, it says allergy symptoms, right? Mm-hmm. I don't want to dismiss the allergy symptoms, but I think the allergist is really limited in their scope, what they think are allergy symptoms. Because I can tell you right now is that when we're looking at allergy symptom, it's not just the itchy hives, the rash, the throat swelling, right? The most common allergic symptom I see for people with mast cell activation syndrome is that the histamine actually causes, believe it or not, think about it, science, write this down, everybody. Histamines in the blood vessels causes local swelling, okay? Local swelling, the blood vessels dilate. So then there's swelling. So it gets super swollen around the intestinal walls. That causes decreased digestion, decreased absorption, right? And because of all that swelling, there's a lot of liquid, that water that's being drawn into the bowels. Instead of absorbing it, it's actually adding to it. And then all these inflammation cells are starting a war zone in your whole gut with this. So one of the major symptoms of histamines in your gut is gas, bloating, diarrhea, pain, cramping, or the food just sitting there. Your bowels refusing to move. Boom.
And yet when you're going to the doctor to get help for some of these issues, no one is bringing up, oh, maybe it's a histamine problem.
Well, the thing is, the allergist is not your GI doc. And your GI doc ain't an allergist. So then they're punting all over the place. And so instead, you go to the allergist and they're just like, let's just prescribe some allergy medication. This is an issue, by the way, everybody. Speaking about the treatment for mast cell activation syndrome, I know we're going off topic a little bit, but those of you that have mast cell histamine or have seen the allergist, these are the drugs you get given, right? The Allegra, the Claritin, the Singulair, maybe you're lucky, some of the other drugs, the nasal chrome, the sodium chromolam sodium, or ketotifen. But one of the most common drugs they prescribe is actually Zantac, famotidine. Mm-hmm. And one of the reasons is because this is interesting, science, everybody, is that there are different kinds of what we call histamine receptors. Like we call them H1, H2, different receptors. So while, and proton pump inhibitor, right? So what happens is the famotidine, Zantac, one of the main reasons we take it is to shut off stomach acid, but it also shuts off the histamine receptor in the gut. So they're like, let's just give this antihistamine, which is Zantac. But the problem is they're shutting off your stomach acid, which then what creates more histamines. So it doesn't work. Wow, it doesn't work. And we're just talking to Nellie on Monday. Remember, Jason? We have somebody, we have people we're working with who have seen these docs for mast cell, and they're on like 3 to 6 different medications. Mm-hmm. And they're like, I don't even know how to make tails or ends of it. And the thing is, she's taking like 3-4 medications and it's not working. If it was working, we're talking a different story. And as we're going through even the medication list, thinking about this, the last medication that somebody with mast cell should be on, or histamine problems, should be on like a Zantac. Even though it has an antihistamine receptor blocking ability, it also blocks your stomach acid, and that's no good. That is not good. You don't want to kill your stomach acid.
Yeah, and I was going to say too, in the chat, Karen H mentioned that she was lucky to have an allergist that was respectful and recognized the mast cell activation syndrome, but they don't know what to do with it except for Zantac, right? So, yeah.
Look at her cardiac symptoms. Karen, thank you for bringing this up. I want to really jump in on cardiac, okay, everybody? Histamine pathway triggers cardiovascular. Please know this is scientific. Please write this down. Okay. And please no longer let yourself be medical gaslighted, because here are the symptoms of cardiovascular effect of histamines. Your heart rate can increase. Okay. People can even have arrhythmias like AFib or PVCs. People can have blood pressure change up or down. People can develop symptoms related with POTS, postural orthostatic tachycardia syndrome, or dysautonomia. People may just have vertigo. Okay. Meaning dizziness. All of these can be absolutely linked to an allergic reaction environmentally or to food relating with mast cell or histamine intolerance. Boom. Write down in chat right now that's you, so we can validate this for everybody else, because let's not ever be medically gaslighted again. And that being said, I'm going to say something here, okay, is that POTS and dysautonomia, these kinds of symptoms don't belong in the cardiologist's office because it is not a cardiology heart-based problem. It's a mast cell activation, histamine intolerance, digestive issue, and even autoimmune related issue.
And a while back, actually, Heather had mentioned, hey, this is before you mentioned POTS. She said POTS symptoms, I believed, are combined with this. So smart, Heather, because she was connecting the dots for herself. And yet I'm sure she's not getting help in the medical field.
Well, and that's a good question, Heather. You know, like you're smarter than your doctors because she's combining POTS with mast cell. And we talk to people on the phone every day who are making these connections, right? And when they call us and talk to us, they're talking to people who, yes, I know exactly what you're talking about. Yes, it's real. But I'm wondering what kind of reception she's had trying to work with her medical providers on this, because I will tell you right now, 100%, well, 99.9% of medical doctors would be dismissing this connection that she's making. And it's really real and it's really scientific, Heather. You are currently smarter than 99.99% of doctors on the planet.
Mm-hmm. And she says she wasn't even diagnosed with mast cell officially, but she does have a good doctor, she says, that knows she has these symptoms, but no treatment yet to help.
Okay, so Heather, we're going to move into solutions. Okay, we will, as we're talking about this, when you're thinking and realizing what the cause is, who wants solution to mast cell, right?
Yes, and yes.
and because we just talked about digestion as being the big problem, you guys have to realize. And I'm going to jump into this real quick because we've talked about this in other videos, and I don't want to be about this. When we are talking about the food mapping masterclass that we have, a huge piece of this is this left upper corner digestion. You freaking please, people, master the digestion. There's nobody else teaching this. In our food mapping masterclass, we teach you how to understand, master the digestion pieces. We also test you for those food sensitivities, so you're not on elimination diets that make you worse. And people on mast cell histamine are on crazy ass elimination diets that are making them sicker. And then we really want you to understand the role of histamines in these food reactions, right? And then also why people get so nutrient depleted as a result of this. So this is my food mapping masterclass, but critically right here, number one, digestion, bing, 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 bing. And I will tell you right now, we fielded hundreds of calls over the last month. And I would say the number one thing that's making people knock on the door and they're screaming and saying, you're the first person I heard that really links my GI symptoms, my gut symptoms with my food reactions or food allergies. Or you're the first one to link mast cell with POTS. Or you're the first one to link autoimmune issue with mast cell or POTS, right? So this is really hitting a nerve. And I want you to know that you absolutely can fix this, but I don't see a masterclass in digestion or food allergies out there anywhere. It doesn't exist. I put this together into one program specifically because it answers every single piece that's missing in mast cell and dealing with POTS and histamine. Dr. J?
Yeah, I have a comment and then I want to have a question. The comment is, as far as putting the connection with digestion, again, there's just no one else doing that. You know, I just want to just out myself a little bit. I have, 24 years, 25 years of doing this, not quite as many as Dr. Maggie.
She ages of me.
Yeah. But that all said, I never got the connection with digestion and mast cell until, we started working together. And it's just mind-blowing. And again, I've got 2 doctorate degrees. I've got, certified in functional medicine. And no one flipping said this, right? That's my comment. So awesome. The second thing, before we move off of cardiovascular, I have a question from Lisa S. Had a question about pans and pandas. And I just wanted to do that connection because it's everybody needs to hear this because these are usually considered psychiatric disorders, right? So let's
if you guys pay attention, okay? PANS, PANS, and PANDAS, PANDAS. They're acronyms, but really it's a condition where children will get infected with strep, certain strains of strep, and the strep infection will trigger a whole variety of symptoms all over the body, including food allergy related, tics, neurological, autoimmune type issues, bowel issues, joint pain issues, a lot, comprehension, focus, sleep, emotional. It's a big deal. And there's no one out there that's really treating PANS and PANDAS adequately because what's going on is they're just hitting them with more and more antibiotics to kill the strep. But the thing is, it's like Pandora's box opened, like the strep triggered this Pandora's box. And it almost, what it is that it uncovered underlying predispositioning, meaning that there's already some family history of autoimmune disorders. There's already some family history of food allergies. There's already some family history of digestive issues of autoimmunity, right? And then you put the trigger on top of it, which is an infection. And this trigger, the infection then causes what we call cellular mimicry. It tricks the immune system into thinking that your own body actually is a foreign object and starts attacking it. Okay. And so then it will attack multiple systems. And in PANS and PANDAS and in Kawasaki syndrome, there could be cardiovascular results as well, with kids getting like atrial fibrillation, cardiomyopathy, a lot of cardiac type symptoms as a result of this infection. But what goes in there with PANS and PANDAS is there's major digestive issues underneath it. There's autoimmune issues in the family, right? And then huge amount of food reactions that happen when these kids get the PANS and PANDAS that nobody's addressing. What do? Throw more antibiotics at this. Throw more antibiotics, kill more good bacteria in your gut, more histamines. By the way, every time you kill bacteria and you kill candida in your gut, you're actually raising these histamine flares. And when you have a histamine flare, it sucks. So you got to be really careful that you know what the hell you're doing when you're dealing with situations with PANS, PANDAS, when you're dealing with people who have a lot of these mast cell histamine issues and you're like killing an infection, you can be setting off a whole hell of a lot of hurt with these histamine storms.
Mm-hmm. And people want to know, can strep throat that they've even had years and years ago be the start of all of these issues?
Yes, yes, and hell yes, Joe. We actually see it. Jason, were you going to say something about you?
You just said
right on the nose, right on the nose.
Yeah, because by the way, like in one of our programs, we actually test people's gut flora, and I actually see specific strains of dental, oral, and vaginal strep that are actually present that become residents and infections in people's, and strep can. The interesting thing is, even if you think you've killed it, and how many people have been through multiple rounds of antibiotics with kids for ear, nose, throat, or dental, right? Or acne. Like that's the other thing. How many was on tetracycline, minocycline? Me. Okay. The use of these antibiotics actually is problematic because what's going on is the balance between the good and bad bacteria, which is why we're going to talk about supplements in a second. Good bacteria and bad bacteria, like they balance each other out, right? But if you're constantly hitting antibiotics with it, or you even had an infection in the past of something, it alters the balance between your good and bad bacteria. And this altering the level of these bacteria is actually, believe it or not, it's part of your whole immune system. How much of each of these bacteria is actually how your whole immune system is like this moving, I call it tectonic plate. It's almost like the earth where certain parts will come down and the volcano will come up this side. Like there's tectonic movements in your immune system. And when you get a strep infection or any infection, it switches that really big time. When you take an antibiotic, you're moving it again big time. These moves in the immune system plates will be the triggers of autoimmune disease, will be the triggers of new diagnosis like mast cell activation. Your allergic system is part of your immune system, just like your infection system is part of your immune system. They're just different branch. When you screw up one branch big time, you're going to flare up the other branch. So we see people with autoimmune disease develop mast cell. We see people with mast cell develop autoimmune disease and vice versa because they're totally linked, because this is all this tectonic plate of your immune system that are doing all these different things. Does that make sense?
So much. Yes. People are saying you're finally connecting the dots. This is the only time I've ever heard someone connect the dots. And we're getting a lot of questions coming in about some solutions, and people are wanting to know, about, hey, it's probiotic.
Oh, probiotic. Oh my God. Thank you, Monica. All right. So I'm going to share. All right. Thank you. I'm going to share my screen really. Probiotics are really important. Okay. But the question is, we're in the age, guys, now where it's not just like, oh, go get any old probiotic, because specific strains are really good for specific purposes. Okay. Mm-hmm. So if you go, for example, like I'm just going to look at right here, looking at 2 of our probiotics. If you check out the QR code and go to the store, we actually have a whole probiotic line of various strains with various needs. But these are our powerhouses. When I look at this, Proflora AI is on the right lower corner with the yellow. That particular formula is really great for people who are dealing with mast cell histamine or food sensitivity reactions, because there's a specific strain that's studied in there that actually is known to be helpful for decreasing histamines. So we're in the age, people, where probiotic strain population in your gut for a specific purpose is their targeted therapy. Just like Proflora GI is one that's really great. That particular strain and the strains in there has been clinically shown to be really good for people with active GI infections, gut infections. So I know the people we work with, they have likely a gut infection. They likely have a ton of food allergies while they're in here working with us on food allergies. So we actually like to rotate these. How I do it is I have them rotate AI and GI back and forth. These 2 are really great options. We even have like a chewable probiotic. So I am seeing tons of dental, ear, nose, and throat problems in adults and with kids. So when you're looking at a kid and you're like, oh my God, who has a lot of dental problems or who is taking all these recurrent antibiotics, well, what's a mom to do? Well, Proflora chewable. Proflora chewable has specific strains in there that are really good to help balance out the bad bacteria. There's a dental microbiome of good and bad bacteria. So Kara Price, using it, chewable game changer. Kara, tell them what it did for you. Like, don't take it from me. Take it from people who've used the product, right? So I love being able to be like now we're able to look at people's history. We're able to look at people's food allergies. We're even in some of our programs looking at the bacterial mix, and we can say specific targeted therapies for those issues, even including probiotic strains.
And I'll just say, I take the chewable and love it. But my son, who's only 5 years old, I give it to him daily as well, and loves the taste, by the way. It's like favorite part of the day. Oh, I get my probiotic now, Mom.
Well, the funny thing is, our digested is our best selling digested. I love naming our supplements, by the way. I get a kick out of naming these things. There's some funny names, by the way. If you want to go in the store and check out, there's some funny names. And I've asked alumni to contribute to naming these with me. So this is a multiphasic digestive enzyme that digests at every step. So problem is sometimes people just get a product that's one thing. And then the other problem is some people get a product that has everything in it and has 50 ingredients, and with mast cell histamine, they can't tolerate it. So I love the fact of getting every step covered with the minimal amount of effective ingredients is what Digested does. And I tell people, if nothing else, start this, 1 with the small meal, 2 with big meals, right? Mm-hmm. And then if you can't swallow it or there's an ingredient you don't like with it, Digested chewable, I don't think I put it in here, but we have a product that's similar to Digested and it's chewable. And
my son's on that one too. He's on that one too.
The kids love it. The kids call it my food vitamin. And then they do the Digested chewable. But the other cool thing is a lot of people with mast cell and autoimmune issues that we deal with have swallowing problems. So if you can't swallow Digested the capsule, then get the chewable. So there's a chewable product as well, just so you know. So, I mean, I just want to give people the fact is that there are solutions that you can implement now. And I'm focusing on digestion, where you could just start something for digestion, whether it's swallow or chewable for you and your kids. You can also start probiotics. And I think that's really a great option, right? Dr. J?
Yeah, I want to just take us down a slightly different road, but related. As we are discovering, the probiotics have a lot of significance in different conditions.
Yeah.
And, we have a lot of those probiotics that are related to psychiatric conditions as well. I mean, you can get really targeted with those probiotics. But the question that I have is, and actually, I actually have this. Rochelle C. actually said, how is this related to my anxiety and my depression and my nervous system? And really, what's going on with mood? Really, what's going on?
Yeah, diagram. And I love this diagram because I want to show you scientifically, by the way, that histamine pathway is related with central nervous system effects. Histamine actually crosses the blood-brain barrier. This is really important, okay? Scientifically, histamines don't just they could start in the gut, right? But then they cross the gut-blood barrier into the bloodstream. Histamine flows right to your brain. And in fact, people, Histamine, in fact, impacts on brain neurotransmitters, which is your brain hormones. Did you guys know that? Okay. So what happens is that you will notice, and type it in chat, when you get like a histamine reaction, you get anxious, depressed, brain foggy,
Yes.
right? And this is why, do you guys know kids? I'm going to go even one step further and bring it back to kids. Kids with autism spectrum, okay, or ADD, okay, they have so much food allergies. It's not even funny, right? And yet, it's not diagnosed in any way, for shape, or form, but they're getting inundated with histamines in their brain. And then you wonder why they can't focus. You wonder why they're having anxiety, why they can't sleep, why they have nightmares. Histamine has a major impact immediately and lasting on brain development, but also the symptoms that your brain and mental health are experiencing. So it's absolutely real that histamine reactions are linked with mental health changes and neurological development of your brain.
Well, that's fascinating. That's fascinating for all the parents out there who are dealing with children who have food allergies diagnosed, or food intolerance that because maybe you're connecting some dots now and saying, oh my, some of these behavioral issues that I've seen in my children can tie back to this. And yeah, Dawn is saying, absolutely, that's me and my daughter to a T.
Right. And then Dr. Jason and I earlier was just talking about a patient with migraines. Migraines is neurological in the brain. And do you know what the underlying mechanism is? Anybody know what the underlying mechanism of migraines? When someone has a migraine headache, typically is different than a regular headache. There's a lot of neurological other symptoms with it, with like eyes watering, the sound hurts, light can hurt. Migraines suck, right? Mm-hmm. And migraines have a lot to do with hormone balance. We work a lot on hormones with the hormone masterclass, right? But the mechanism for migraines, main mechanism, is that there is an increase in something we call nitric oxide that causes the dilation of the arteries in the brain. When the brain arteries are really dilated, then there's swelling and fluid is moving in and out of these arteries, affects blood pressure in the brain. And does it sound familiar with cardiovascular? It's almost like a migraine's like pots in your brain.
Wow.
Right? Literally, then the blood pressure changes, fluid content changes. The dilation of these blood vessels causes migraines. Now, what else causes dilation in those blood vessels? Histamines. So can histamines cause migraines? And the answer is yes, yes, and hell yes. This is why some people, when they eat certain food, will get a migraine. Boom.
And I just have to point out a couple of fascinating comments that have come in since you started talking about this. Felicia says, getting on the right probiotic and reducing histamine is a game changer for her son's speech delay.
Correct.
And then additionally, Naomi saying, when she takes Benadryl, it actually improves her mood where the SSRIs have failed.
Right? Attacking it from a histamine route for her mood disorder works even better than taking an antidepressant, because she's actually attacking a root cause. I'm going to one-up you, Naomi, in that why not remove the histamine production in the first place by figuring out which foods exactly is causing the histamine release, right? Let's one-up you, Naomi. Let's do it, okay? But let's talk about that for a second, because then I want to talk about solutions too. Like, another solution is on this right side is about the data piece. The yellow thing here is about data, right? So I want to let you guys know that you absolutely can test. There is a way to test to figure out which foods is triggering your mast cell and histamine intolerance. And I'm gonna take a minute to talk about this, and it could be a little ranty, everybody, which is that I don't know how many people have been diagnosed with mast cell and histamine intolerance, right? Or they really think they have it, only to find out when they do food mapping that it was something that, like, one or two things that they were eating that they didn't know they were eating, and they were eating on a regular basis, that caused their histamines to go crazy. Once they remove those two things, they don't have mast cell histamine intolerance anymore. I know there are hundreds of you. So if anybody is in that group who's worked with us with my food mapping masterclass or in our main program, type in chat, share your story with people. Because Jason, Dr. J.
Yeah, I just wanted to jump in here too, because I think that it's even more pervasive, possibly because of people going gluten-free. Now, hear me out on this. I'm not advocating gluten at all. That's a whole histamine problem in and of itself. But what people do, and I understand the logic behind it, is I'm going to go gluten-free and I'm going to eat all these gluten-free products. And a lot of those gluten-free products, I'm just going to pick on almond for a minute, almond,
right?
almond milk or almond flour or almond this, almond that. And people will end up consuming something. And then we run their food, sensitivity profiles.
In large amounts.
Yeah. And then we find out that almonds or oat or whatever, whatever it happens to be, like that they've substituted, is just off the charts. And it's actually been perpetuating the problem. And then when we get that specificity, we're able to say, hey, you know what? Almonds aren't a good choice for you, or oats aren't a good choice for you. And they make those changes, like those personalized changes. And then all of a sudden their MCAS, starts going away and their symptoms start, and it's just a simple change based on data.
I have a story around this. Actual client, Gina, and Gina was diagnosed with mast cell activation, histamine intolerance, and she went to her allergist to get her IgE testing done, and nothing really showed up, right? And so as a result, she went on an elimination diet, and she was told by her allergist and to just eliminate some top allergens, but also she went to a naturopath, functional medicine doctor as well. They said, you know what? Let's just eliminate like the top 9 allergens, right? And that's what she did. And she got worse. Okay. And so here's how I solved Gina's mast cell activation disorder in 1 week. We actually did our food mapping. In our food mapping program, we did our specific test. Okay. And in the specific test, we found out a couple things. She was told erroneously to avoid eggs. She didn't have to. That was the main protein she loved. Okay. She was a vegetarian, but she could eat eggs, but then she was told to eliminate eggs. She had no protein. Okay. Number 1. Number 2, she eliminated gluten and ate almonds like crazy. And all she did was, we found out it was almond. Okay. She eliminated the almond, and within 5 days, 80% of her mast cell and histamine issues she's been dealing with for 9 years are gone.
And it feels like a miracle to people who think that this is never going to get better. And you can eliminate it within a matter of days to weeks.
I think it's the question of, do everybody we're talking about really have mast cell activation syndrome and histamine intolerance, or do they just have food sensitivities that their doctors fail to identify scientifically and accurately? Mm-hmm. I think that is another thing. So I'm not a fan of labels, people. All right. I'm not saying you all have mast cell or histamine intolerance. What I'm saying is 99% of you that are on this chat watching this video right now have tons of food sensitivities that you don't know, and your doctors don't know how to accurately diagnose for or test for. And that, to me, is one of the biggest solutions that we offer, right? It can be that clear and it can be that simple. I'm going to have alumni in chat. If that was you, where it was like this, it was broccoli, and you're like, oh my God, I thought broccoli was great. For Anne, she said, mine was milk, gluten, and sugar. Told to do the same. Yeah, a lot of people. So it's wouldn't it be great to find out what if it was broccoli and sesame? And you could eat all these other things. And my best thing is, a lot of people, mast cell, POTS, histamine, food allergies, think they're going to come in here. We're actually talking to somebody who was had a 13-year-old daughter the other day. And the assumption is, I'm going to come into the food mapping masterclass and I'm going to be told to eliminate a lot more stuff. And I'm going to have people chime in that have worked with us. And the question I have for you is, were you actually eliminating more foods, or were you actually adding more foods back in with the data while getting better? Right? That's the biggest misunderstanding, is that with the data in your hand, how would it feel to know exactly what to add back in with confidence, without fear, without trauma, while getting better and better? That's the key. I think that's an important misunderstanding that people have about, working with us to clearly use science to identify what foods you have a problem with and what foods you don't have a problem with, right?
And I've interviewed so many alumni who said, there was even one that stood out that said she was down to 3 foods. She only ate 3 foods. Yeah. And this went on for years. Yeah. And until she went through your food mapping and realized, I don't even need to eliminate all these foods. She was able to add back in a whole world of possibilities. And that is not an uncommon story, although, you know, that was an extreme example. But almost everybody says, oh my gosh, I only had to eliminate a handful of things, and I added so much back into my diet.
Mm-hmm. Well, I think the thing is, I think when people have all these allergic food reactions that seem random and unexplained, they're traumatized with every time they eat. And then they so much more further traumatized when it's their child, or if they have to go out in social situations, we have to eat. So it's almost like, it's not like you could just avoid it. It's not like cocaine. You can just say no to cocaine. It's like, you got to keep eating. So people get traumatized over and over and over again with this. And so for me, I totally forgot my train of thought here.
Well, then let's talk about Kara, who's just really sending the point home of what we were saying. You know, she thought she was going to have to eliminate more foods. Already was so limited. She was only eating 25 foods about. But instead, she added the majority of foods back in.
Well, I'm going to talk about this because Kara had that mindset as well. And I was talking to, we were talking to, I think it was Chrissy, and some of these people who say, I'm down to 5 foods. And I always say, why? Because when we go over these results, I'm always like, why are you down to 5 foods? And I was thinking there was going to be some, major scientific or medical reason. And the answer was fear. Fear, Dr. Maggie.
Yeah, and we're seeing a lot of people in the chat mentioning even PTSD around food, like literally like severely traumatized by food and food decisions. So there's a lot going on there.
So that's why when we go back to this, talking about mental health wise, it's like, I really do think that it's a major issue where people are sitting here and they're saying like anxiety, totally missed the slide, but there is this whole thing where, yes, histamines causes anxiety, ADD, brain fog, memory issues. But then again, having mast cell and histamine issues or just unexplainable medical symptoms makes you feel like you're insane and you're told that it's all in your head, right? So it's like a chicken or the egg situation over there, right? And we haven't even gotten to hormones or cancer or skin, by the way.
We have several hormone questions, by the way. And I'm glad you mentioned that because, Marissa's saying, do hormones cause digestion issues relates to mast cell? And she wasn't the only one who wanted to know about hormones.
So just so you saw in that diagram right there, histamines is directly responsible in clinical studies to actually affect the level of estrogen in the uterus. Okay, boom, there you go. All right. And so the interesting thing is that there is a mechanism and many mechanisms. So directly histamine can cause hormones to be different and that can shift hormonal balance. You already know, I've made a million videos on how your hormones suck, your hormones are out of balance, and your doctors don't know jack about how to turn it around. Excuse my French, right? But at the same time, I want to tell you that it is related to food because that just having histamines will affect your hormone levels, right? But then here's the other problem. Remember, people with histamine problems have a lot of digestion problems, right? And then people who have digestion problems, one of the biggest areas of digestion is the last step in digestion, which is fermentation, okay? We ferment food. Fermentation is in the large intestine at the very end, good bacteria sitting there working on the food, and they're breaking down food, toxins, and hormones down, okay? People with histamine issues have terrible digestion issues. Therefore, a lot of different types of bacterial mixes in there. Their fermentations suck. So they break down hormones horribly. So the imbalance of these hormones get worse. Boom. Hello? You guys write that down? Did you write that down?
And I think too, coming back to hormones and digestion and just the process of digestion, I thought when you said the last step in digestion, I was going to answer elimination, right? So I was going to the end result.
And that's also an issue though. Go ahead.
Right. And that's the thing. Like a lot of folks have, GI upset, whatever that happens to be in these symptoms. And a lot of times they'll get constipated and they're not moving, excuse my French, but they're not moving the crap out, right? The literal crap. And then the hormones are not broken down and they just get recirculated into the body. And that happens all the time with mast cell. We see it all the time.
Yeah, and the thing is, step 5 is bacterial fermentation and step 6 is elimination. But even then, how many people are constipated? If you're constipated, you're not breaking down your hormones. If you're constipated, you're not clearing your histamines. Okay. So it's really important to understand, what you don't, if you're constipated, one of the biggest things I tell people about constipation is that if you don't poop every single day, one of the best cures for hormone balance and histamine problems is to have a bowel movement every day. I'm just saying. Okay. Why? Because every day that you poop, you're clearing toxins, excess hormones, right? So, that it's just something to remember that having a daily bowel movement is really important, but yet The other way around, diarrhea also isn't great. So it's important to understand that elimination is really important, but proper fermentation leads to, and then healthy daily elimination every day, really key to hormone balancing and histamine intolerance.
It's fascinating.
Getting a lot of questions as well. Just want to ask you, people are talking about burping. I've seen a couple of people come in here and say, for the last 2 years, I burp constantly. And someone else says, sometimes before I have an episode, I have this sulfur tasting burps.
Yeah.
Is this common? Is this related to mast cell?
Yeah. Burping is the number one symptom of people with low stomach acid.
Okay.
Broken digestion, everybody. Take your burping as your body talk, saying, hey, Allison. Hey, Dawn, you got a digestion problem. When are you going to hear me? Are you going to understand my language? Right? Your gut is, your symptoms is your body talking to you. Allison, your body loves you and wants to talk to you. When are you going to listen? Right? Broken digestion. Got to fix this. Right? So, and one step definitely is starting something like digest it. But the other thing is you need to be the pilot. You need to learn about how to master your digestion. It's the tip of the iceberg. Our food mapping masterclass is a masterclass in digestion, and it's really needed, and it's absolutely missing in the medical space.
Okay. And what about when you get a blood test and you see on your blood test that level of eosinophils being high? People want to know, does that mean there is a connection here between seeing a high eosinophils and having mast cell?
High eosinophils are part of your white blood cell system. We actually have many different kinds of white blood cells. We have basophils, eosinophils, neutrophils. We have mast cells. They're all armies in your immune system. And eosinophils is actually one that is associated with allergies or parasites. So what you find is if someone's having a lot of allergic reactions, or your body hates parasites, by the way. If you happen to have a parasitic infection of some type, your body will make a ton of eosinophils and send them to those allergens. So yeah, you could have elevated eosinophils in your regular blood work, and it could be a sign that, oh, there's something allergic going on, because that's a response, right? It's responding to something. So that's another sign that, yes, allergies could definitely be an issue here for you, Missy.
Okay.
Well, I think it's interesting too that, eosinophilia is actually the diagnosis, and it doesn't really go much deeper than that. It's like, oh, congratulations, we diagnosed this, but then what do you do? And I think that's another common theme that we saw on the social media posts and in the comments here, is that maybe they got lucky enough to work with the doctor that I know we don't like labels, but can label it, but they don't know what to do, even if they can label it. There's no treatment.
Dawn's daughter has eosinophilic esophagitis. Say that 10 times fast. Dawn, you can do that, say that 10 times fast. And they're totally like, these are all, she's starting to make the connections. That's so cool. But her daughter with EE, like, what's the solution? You are diagnosed with tons of eosinophils around your esophagus, which is right here. What do you guys think is the cause? Type in the chat, everybody. Type in chat. You've listened to anything. Why would Dawn's daughter, I don't know her age, let's say 13, be diagnosed with tons of eosinophils along the esophagus? Type causes in chat right now. You just learned from me. Come on, do it. Okay, make me proud, everybody. Right? And people are like, right? And so when I look at eosinophils, there's no treatment for EE out there. No. The doctors just say, you got the diagnosis because we have a biopsy that actually shows all these allergy cells there. And I'm going to say, what the hell is causing that reaction? What are those eosinophils responding to? And the answer is, number one, food sensitivities. Number two, poor digestion causing increased food sensitivities. Boom. Dawn, we just solved your daughter's problem. When are we going to make that happen? Right?
Yeah. She was diagnosed at 8 years old. Maybe strep, even a part of it too.
Yeah, and you'll see something like, oh, as a kid, she had a lot of strep, and then now it's turned into other diagnoses like, eosinophilic esophagitis, right? Poor digestion, Loretta. Yeah, right. And Loretta has been through a program. She's learning this. She's implementing it to all her kids as well. Like, how does that change her kids' lives? If you're not going to do this for you, like, why won't you learn to for your kids, right? Don's like, awesome.
You cracked a case today. I mean, you cracked. This is the stuff that I get so excited about when I see on some of these lives that you're able to really interact and solve this issue that's been unsolvable for people for so long, or at least come to find what is the root cause and then offer some solutions.
These are not difficult cases to crack. And I could do a whole show. I could be here for hours just saying like, crack your case, crack your case, crack your case, crack your case. Here's how I would do it. A, B, C, D, E, go. But the interesting thing is,
I've seen you do that. I just want to say I've actually been on these calls, and it's like you're the I don't even know what the word is, but it's like some intuitive Jedi mind trick or something where you're just like, I know what that is, and here's what it is, and you connect the dots like so quickly on these really chronic cases. It's awesome to watch.
I actually am medically intuitive. So I would say that that's something I have learned about myself. People talk about seeing a medical intuitive. I honestly, the only way I can explain how I see these patterns and things is there's absolutely like a medical intuitiveness. And it's so interesting. It's not even what people tell me. A lot of times it's not even it's what they don't tell me. Like, and in the mastermind calls, Jason, I have this line where I'm like, I know you, like, I know a good melon. And it's because I don't know why, but I just see these things. But the cool thing is my husband says it's her fruity.
Yeah. She's not the only one saying you're magic.
But I want to teach you guys how to do that. So every single one of my programs, whether it's the hormone masterclass, the food mapping masterclass, our new Ignite program, or our main Transform Fundamentals program, any and every one of those programs, I'm teaching you how to think like me. Dr. Jason is teaching you how to think like him. I mean, and I think it's been really cool. Like sometimes recently you said, can I just have 30 minutes to download your Jedi mind trick on that? I was like, cool. And we went, and he's like, oh, that makes so much sense. And I get all excited because I get happy, not just like cracking the case. I get happy seeing somebody else being able to start cracking these cases, whether it's you, Dr. Jason, or anybody. Like, I think everybody and anybody can learn these skills given the right education and mentorship. I
just wanted to show my notes from that 30-minute download. It's 4 pages long. And it's just like, I was just like frantically like trying to keep up, but it's mind blowing. It's cool.
It's so much fun.
Well, right, Dr. Maggie, I know we've been going for over an hour now, and it's because we have just so much to get to and talk about, but you have opened minds, opened eyes to this topic to show that there are so many other symptoms. It's not just the ones we think about when we think about mast cell and histamine intolerance. It's not just hives. It's not just itchy skin. It's not even just anaphylaxis, which is very scary. There's so much more that goes into this.
Yeah.
And best of all, you know how to fix it.
Well, here's the thing. I can't crack your case if you don't talk to us. We can't crack your case here. We can't play full out with you if you don't talk to us. You're
that intuitive, right? I mean, you got to talk to us, right? So
I'm not that intuitive. Maybe I am for YouTube, whatever. But like, you got to talk to us, man. So like, what I'm going to tell you right now, if anything resonated with you here today and you're like, holy hell, I need these solutions. Because the thing is, we have a variety of different programs. We deal with every difficult diagnosis known to man. Nothing scares me. I eat danger for breakfast. We eat danger for breakfast. It's fun. I love cracking cases. And so, but the thing is, you got to talk to us. And we used to only have one program, and now we have 6. We have 6 programs, and we just added a 7th. All right. Mm-hmm. So if you thought it wasn't possible to do one of our only program before, you're wrong. Okay. So I would say book a call with our team now, talk to us. And I want to, because if we don't know what's going on, I can't tell you how we can help. And you have no idea how we can help. So eyes wide open now. Eyes wide shut. There was a movie around that. So yeah, definitely, get on a call with our team. It's free. Okay. But just get on a call with our team so we can talk to you and see if it's something we can help with, because I see things. We see things. Mm-hmm. We know people who know people right here who can fix these things.
And it's like Felicia's saying, she says she could not have solved some of her problems without your masterclass. It was the best investment, period.
Aw, Felicia, which class did you go to? Type in chat. Let them know. I love it. Thank you. You know,
I just wanted to say too that, you know, just since we've connected, what I've really found on the mastery calls and just the whole process is that you've made it fun. Like I mean, it's a weird thing to say. This is a weird thing to say because these are chronic, you know, it's chronic conditions and symptoms, people suffering for decades. And somehow, as we're cracking these cases, it's a fun thing and people enjoy it and they have a lot of fun on the calls. And I have fun on the calls. I mean, it's something that's missing from the health and healing, and you've put it right back in.
You know what it is? Just I genuinely love people. And I genuinely think that humor is the antidote for everything, right? So for me, like, I don't know, we were just talking sleep apnea the other night. I mean, I'm not even going to get into sleep apnea. We talked about hair loss the other day with our group, but just talking about sleep apnea, I was demonstrating to people like the best way to diagnose if your partner has sleep apnea. And that's where my acting classes paid off. No, I didn't. But I'm just saying, like, I reenacted what exactly someone with sleep apnea would sound like. It was impactful because right away, 3 people raised their hand. They're like, holy hell, my partner has sleep apnea. I was like, get him a sleep study. I love it. All right, everybody. That is a wrap. Dr. J, do you have any final comments for anybody? And then I think I'm out of here soon. So everybody, that was wonderful. Over an hour. Dr. J?
Yeah. No, it was a great call. And I think the big take home for me and for I think everybody on the call was that it's bigger than just allergies, right? It's bigger than rashes. It's bigger than itching. It's bigger than watery eyes. It literally affects the whole body. And we saw it in the chat. We saw it in the Facebook comments. And I mean, people need this help. People need this help.
100%. And if you know somebody who can benefit from seeing this video, type their name in chat. The other thing is I do have a 3-part training on mast cell activation syndrome. If you want the 3-part training, type it in chat. A member of our team will get that to you. We also have an allergy protocol for supplementation. So if you want to learn more about supplementation that I've been teaching here, we have an allergy protocol. So if you're interested in getting the allergy protocol, just to learn more about supplementation, type allergy protocol in chat so you can learn more about supplementation. Okay. Just type it in chat. Hit me up with some comments. All right, everybody. That is a wrap, everyone. And
Dr. Maggie and Dr. Jason, on behalf of everybody that's watched and all of the comments that are coming in, thank you so much for your time and for investing your knowledge and sharing it with everybody because we're not hearing it from anywhere else. So thank you.
Peace out, Scouts.